Visual pathway and effect of lesions. Visual apparatus is composed of a number of structures that have to work in unison to bring about precise focusing of the image on retina, and further impulses from retina have to reach cerebral cortex through efferent nerve to get a clear picture of subject or object that is in view. Hence, it is quite essential to understand visual pathway details and what could be the problem if there is lesion in any part of the visual pathway. Retina. Photoreceptors or receptors for vision are present on retina. The photoreceptors are rods and cones. Part of the retina lateral to optic nerve emerging from eyeball is termed as temporal half of retina, and part of retina medial to optic nerve is called nasal half of retina. It has to be noted here that part of retina from where the optic nerve fibers emerge is known as optic disc and is devoid of any photoreceptors. Hence, this part of retina is termed as blind spot. Even if light rays get focused on blind spot, a person is unable to see the object. Visual pathway. When light rays get focused on retina, photoreceptors, rods and cones get stimulated. Efferent impulses from these receptors are carried by optic nerve. Along the pathway, optic nerve fibers are grouped into two divisions, namely temporal half of retina fibers and nasal half of retina fibers. Temporal half of retina fibers do not cross the midline and continue posteriorly on the same side, whereas nasal half of retina fibers cross the midline just above the pituitary gland, forming optic chiasma. After crossing midline, nasal half of retina fibers of right side will join with temporal half of retina fibers of the left side and form optic tract. Same situation occurs on the other side of optic pathway as well. Optic tract fibers run posteriorly and synapse in lateral geniculate body of thalamus. From lateral geniculate body, optic radiation fibers, or also known as geniculocalcarine tract, takes origin and reach occipital cortex area number 17, 18 and 19. Area number 17 is termed as primary visual area and 18 and 19 are known as visual association areas. By this pathway, impulses from the photoreceptors finally reach cerebral cortex and help in perception of vision. In addition to the above, some of the optic tract fibers bypass the lateral geniculate body and reach pretectal nucleus of both the sides present in midbrain. Role of these fibers is essential for reflex changes in pupil, observed when a beam of light is suddenly thrown on eye. Field of vision. The ambient world from where light rays would get focused finally onto retina is divisible into two fields, namely temporal and nasal fields. Light rays coming from temporal field of vision get focused on nasal half of retina, and from nasal field of vision is focused on temporal half of retina. Effects of lesion in visual pathway. In optic nerve, when there is lesion in optic nerve of any side, person will not be able to see anything in the eye on the affected side, as efferent impulses from photoreceptors will not be able to be carried to occipital cortex. There will be complete loss of vision both in nasal and temporal fields in the eye concerned. Hence leads to complete blindness or anopia in affected eye. In optic chiasma, when there is lesion in optic chiasma, nasal half of retina fibers of both eyes are damaged. Hence, efferent impulses from visual receptors from nasal halves of retina are unable to reach occipital cortex, even though the light rays from temporal field of vision are able to stimulate the photoreceptors. This leads to loss of temporal field of vision in both eyes, and this is called bitemporal hemianopia. Enlargement of pituitary gland is one of the common causes for bitemporal hemianopia, as optic chiasma lies just above the pituitary gland. In optic tract or optic radiation, when there is lesion in optic tract or optic radiation of any one side, there will be loss of nasal field of vision in the eye on the side of lesion and loss of temporal field of vision in the eye on opposite side. When nasal field of vision in one eye and temporal field of vision in the other eye are lost, results in homonymous hemianopia. If there is lesion in optic tract of right side, it leads to left-sided homonymous hemianopia, or temporal field in left eye and nasal field in right eye. In occipital lobe, unless the lesion is very extensive, lesion in occipital lobe of any one side will also lead to homonymous hemianopia, but with macula sparing. There will be loss of nasal field of vision on the same side and loss of temporal field of vision in opposite eye. What is this macula sparing? In the temporal half of retina, there is a region called macula lutea or fovea centralis. In this region, there is presence of large number of cones. The impulses from these receptors end quite extensively in occipital lobe. Hence, if the lesion in occipital cortex is not widespread, if the light rays get focused on macula lutea, person will still be able to see. This is known as macula sparing. Binasal hemianopia. The selective loss of only the nasal half of field of vision in both eyes can seldom happen. It is only when there is selective damage to temporal half of retina fibers of both the sides person will suffer from binasal hemianopia, heteronymous hemianopia. When there is selective loss of either temporal or nasal fields of vision in both eyes, it is known as heteronymous hemianopia. Light reflex. When a beam of light is suddenly thrown into one eye, there will be reflex constriction of the pupil in the eye of same side. This is known as direct light reflex. When reflex constriction of pupil is also observed in the eye of opposite side, it is known as indirect or consensual light reflex. Pathway for light reflex. When a beam of light is focused onto one eye, photoreceptors in eye are stimulated. Impulses from photoreceptors are carried by optic nerve fibers and optic tract. Some of the fibers of optic tract, without reaching lateral geniculate body, directly end on pretectal nucleus present on both sides in midbrain. From pretectal nucleus, impulses are carried to Edinger-Westphal nucleus. Efferent impulses from Edinger-Westphal nucleus are carried by oculomotor nerve. The preganglionic fibers of oculomotor nerve synapse in ciliary ganglion, and the postganglionic fibers, namely short ciliary nerve, supplies constrictor pupillae muscle. Impulses along short ciliary nerve results in contraction of constrictor pupillae muscle and the pupil constricts. Accommodation reflex for near vision. When a person is looking at a distant object, suddenly looks at a nearby object, reflex changes brought about in visual apparatus facilitate proper and adequate focusing of light rays on the retina so that the image of the nearby object is brought to sharp focus. Thereby, the person is able to view the nearby object. The three major changes that are seen during accommodation are as follows. Constriction of ciliary muscles resulting in thickening of the lens. Constriction of pupil, thereby preventing the diverging light rays at the periphery of cornea and lens from entering eye. Increase in curvature of lens, making it more biconvex, resulting in increased refractive index. Pathway for accommodation reflex. From photoreceptors, efferent impulses are carried to occipital cortex along the visual pathway. Efferent impulses from occipital cortex are sent to frontal cortex area number 8, which forms the center for accommodation reflex. From frontal eye field area number 8, efferent impulses are sent to both the nuclei of oculomotor nerve, namely Edinger-Westphal nucleus and main motor nucleus. From Edinger-Westphal nucleus, impulses are sent through short ciliary nerve to bring about constriction of pupil by contraction of constrictor pupillae muscle. Curvature of lens increase is brought about due to contraction of ciliaris muscle and at the same time bringing about relaxation of suspensory ligaments of the eyeball. From the main motor nucleus of oculomotor nerve, motor impulses are carried to medial rectus muscle of the eyeball through the inferior division of the oculomotor nerve. Contraction of medial rectus muscle results in convergence of eyeballs, or also known as medial rotation of eyeballs. Because of the above reflex changes, person is able to get the light rays sharply focused on retina and is able to clearly see the nearby object. Argyll-Robertson pupil. In this condition, constriction of pupil is possible only for accommodation reflex, but reflex constriction of pupil will be absent for light reflex. The reason for constriction of pupil being absent for light reflex is there will be damage to the pretectal nucleus in midbrain. Pretectal nucleus is the center for